Hello, and welcome. Today we're diving into a complex and often overlooked heart condition, cardiac sarcoidosis. We'll explore what it is, how it affects the heart, and what can be done about it. Cardiac sarcoidosis doesn't have one single, definitive cause that's been identified yet. It's believed to be triggered by an abnormal immune response. In essence, the body's own defense system mistakenly attacks healthy tissues in the heart. While the exact trigger remains elusive, factors like genetics, environmental exposures, and infections are suspected to play a role in initiating this inflammatory process. It's important to note that sarcoidosis, in general, is more common in certain populations, suggesting a possible genetic predisposition. Now, let's understand what happens inside the heart. Sarcoidosis leads to the formation of granulomas. Think of them as clumps of inflammatory cells. These granulomas infiltrate the heart muscle, disrupting its normal structure and function. The presence of granulomas can lead to several problems. They can interfere with the heart's electrical system, causing arrhythmias, irregular heartbeats. They can also weaken the heart muscle itself, leading to heart failure, where the heart struggles to pump enough blood to meet the body's needs. In some cases, granulomas can even cause constrictive pericarditis, a condition where the sac surrounding the heart becomes stiff and restricts its ability to pump effectively. Furthermore, scar tissue often develops as granulomas heal, contributing to further dysfunction. Cardiac sarcoidosis is considered relatively rare, but its true prevalence is difficult to determine because it can be challenging to diagnose. Studies estimate that it affects around 2 to 5% of individuals with systemic sarcoidosis, meaning those who have sarcoidosis affecting multiple organs. The condition is more commonly diagnosed in individuals between the ages of 20 and 40. Although it can occur at any age, certain populations, such as African Americans and individuals of Scandinavian descent, appear to be at higher risk. It's important to remember that these are estimates, and the actual numbers may vary depending on the region and diagnostic methods used. The symptoms of cardiac sarcoidosis can be highly variable, depending on the extent and location of granulomas in the heart. Some individuals may experience no symptoms at all, especially in the early stages. However, as the disease progresses, symptoms may include shortness of breath, chest pain, palpitations, a fluttering or racing heartbeat, fatigue, lightheadedness, and even fainting. Irregular heartbeats, or arrhythmias, are a common and potentially dangerous symptom. Swelling in the legs and ankles can also occur as a sign of heart failure. Because these symptoms can be similar to those of other heart conditions, it's crucial to seek medical attention for proper diagnosis. Diagnosing cardiac sarcoidosis can be a complex process because its symptoms often mimic other heart conditions. Several tests may be necessary. An electrocardiogram or ECG can detect abnormal heart rhythms. An echocardiogram uses sound waves to create images of the heart and assess its structure and function. Cardiac MRI is a powerful imaging technique that can visualize granulomas and scar tissue within the heart muscle. A PT scan, or positron emission tomography scan, can identify areas of inflammation in the heart. In some cases, a cardiac biopsy may be performed, where a small sample of heart tissue is taken for microscopic examination. This is the most definitive diagnostic test, but it's also invasive and carries some risks. Because granulomas can be patchy, a negative biopsy doesn't always rule out cardiac sarcoidosis. Doctors often rely on a combination of these tests, along with clinical findings, to reach a diagnosis. While there aren't distinct types of cardiac sarcoidosis, the condition can manifest in different ways depending on the location and severity of granuloma involvement. For example, some individuals may primarily experience arrhythmias, while others may develop heart failure. Some may have conduction abnormalities like heart block, where electrical signals are delayed or blocked as they travel through the heart. The specific presentation of the disease influences the treatment approach and prognosis. The primary goal of treatment for cardiac sarcoidosis is to reduce inflammation and prevent further damage to the heart. Medications are the cornerstone of therapy. Corticosteroids, such as prednisone, are often used to suppress the immune system and reduce inflammation. Immunosuppressants, like methotrexate or azathioprine, may be added if corticosteroids are not effective or if the side effects are too severe. Antiarrhythmic medications can help control irregular heartbeats. In severe cases, an implantable cardioverter, defibrillator, or ICD may be necessary to prevent sudden cardiac death. If heart failure develops, medications like ACE inhibitors, beta blockers, and diuretics can help improve heart function. In advanced cases of heart failure, a heart transplant may be considered. Regular monitoring by a cardiologist is crucial to assess treatment effectiveness and adjust the plan as needed. Unfortunately, there's no known way to completely prevent sarcoidosis, including cardiac sarcoidosis, because the exact cause is unknown. specific preventative measures are difficult to implement. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, may help support overall immune function. Avoiding exposure to known environmental triggers, if any are identified, may also be beneficial. However, more research is needed to understand the complex interplay of factors that contribute to the development of sarcoidosis. The prognosis for cardiac sarcoidosis varies widely depending on the severity of the disease, the extent of heart involvement, and the response to treatment. Some individuals may experience mild symptoms and live relatively normal lives with appropriate management. Others may face more serious complications, such as heart failure, arrhythmias, and sudden cardiac death. Early diagnosis and treatment are crucial to improving the prognosis. Recent research has focused on developing more sensitive diagnostic tools, identifying potential therapeutic targets, and improving risk stratification. New imaging techniques like cardiac PET/MRI fusion imaging are showing promise in enhancing diagnostic accuracy. Clinical trials are also underway to evaluate the effectiveness of novel immunomodulatory therapies. Understanding the genetic and immunological factors involved in cardiac sarcoidosis continues to be an active area of research. Ultimately, ongoing research efforts hold the key to developing more effective treatments and improving outcomes for individuals affected by this challenging condition.